progressively older age groups. So the older someone is, the more likely they are to have low lymphocyte counts, which can go a long way to accounting for the increased death rate in older patients. Now, mortality rates for those who receive the mechanical ventilation. Now, even in the younger age group, in the 18 to 65s, if they received mechanical ventilation, still 76% of them died. So only 24% or so survived. So those that were ill enough to need mechanical ventilation went on to die or died from effects of the mechanical ventilation. It's always going to be a combination of those two. And in the older age group, people older than 65, 97.2% died. This is one reason why doctors these days are very reluctant to intubate and ventilate, because especially in the older age group, they're going to die anyway. Good news, no deaths in the younger than 18-year-old age group, so that was good. So as of the 4th of April, altogether 20% of the original, 20% required mechanical ventilation, 3.3% were discharged alive, relatively small, unfortunately, in the time span. 24.5% died, and 72% remained in hospital. And for 45, that's 2.2% of patients were readmitted during the study period. So what this means is that some patients were discharged and then some of those had to be readmitted. Not entirely surprising, because we know people can deteriorate in the second week and the third week of the illness, so that can happen. Now, one of the problems we've had with this association with high blood pressure, we know people with high blood pressure are more likely to get complications. So we know that. People with high blood pressure are more likely to get complications, more likely to die. But is it the fact that their blood pressure's high, or is it the fact they're being treated for the high blood pressure that causes the increased risk? And the answer to that is this study doesn't quite tell us, but let's look at some information here that's interesting. Now, people with high blood pressure not taking angiotensin converting enzyme inhibitors or angiotensin II receptor blockers. So ACE inhibitors or ARBs are two types of anti-high blood pressure medication. They're what we call hypotensive agents. They lower blood pressure. So of those with high blood pressure and not taking medication, 26.7% died. Those taking ACE inhibitors, that's drugs like captopril, lisinopril, anything that ends in pril is an ACE inhibitor. People taking ACE inhibitors, the death rate was higher. And people taking ARBs, that's drugs like candesartan and candesartan and losartan, drugs that end in sartan, SARTAN. Again, more of those died than weren't being treated. So from that data, it's tempting to say that patients that were being treated for their high blood pressure with these particular preparations are more likely to die than patients whose blood pressure was not being treated. But the patients who were admitted not taking medicine for their high blood pressure, it may well be that the blood pressure was a bit high, but their doctors had decided not to treat them because the blood pressure wasn't as high as the blood pressure in these two groups. So these two groups here, because they're being treated, may have had a higher blood pressure, a much higher blood pressure without treatment than that group. So that's possible. And these differences aren't huge. So what the group actually concluded was it's not possible to pick out whether it is the high blood pressure or the treatment for the high blood pressure that causes the increased morbidity and mortality. So still needing further data for that. And if the group who wrote the paper say they can't differentiate, then I certainly can't either. Now, if you want to stick with it, there's a few interesting